Babhlenga, good morning. Thank you very much for your time this morning. You are calling for open tender processes. I mean, I've seen your statement. You're very concerned about what we saw under PPE, where there was alleged fraud and corruption, in that you don't want the same to be repeated here. Now, what is an open tender process? What are you actually calling for?
Well, we are calling for the meetings which will be taking place, whether it's bid adjudications, bid evaluations, or national treasury considerations of the deviations that have been applied for, to be made public and allow for the South Africans to monitor for themselves and to hear for themselves the kind of discussions and considerations that will be applied to the discussions in considering for these tenders. It's our fundamental view as a committee that prevention is better than cure. And of course, we are always hamstrung in that as a committee, we are expected to do an autopsy of things when we come in at the tail end, post-expenditure and so on. And so really, this is an intervention which prevents that kind of challenge which prevails, but also to ensure that there is integrity in the process, and also to avoid a situation where you've got companies being registered today to tender tomorrow, amongst others. And so really we are saying that we have to learn from the lessons of the PPE, and we need to actually have a process which is going to be beyond reproach. And one of the only few ways and options available to us now is this open tender process, which will be subject to public scrutiny from start to finish.
Understanding the urgency with which the vaccines rollout must happen, how feasible is what you are calling for?
Well, if we're having a meeting at 10 o'clock to be discussing the tender processes, then there's nothing preventing people having access to that meeting at 10 o'clock. We are not calling for an extraordinary circumstance here, really. All we are saying is that wherever the discussions will be taking place, subject them to, even if you are allowing media there to transmit those discussions to the public, just like you would have a parliamentary meeting open to the public and open to the media. But what we don't want is secrecy, and also the pressure which is exerted on officials to do wrong things will be circumvented by this kind of public process. So it's very feasible, it's very practical, and in the interest really of good governance if you've got nothing to hide.
You've written a letter to the Ministers of Health and of Finance as we're reporting. Any response, or you don't expect a response, you expect action?
Well, we have sent the letter through late on Monday afternoon, and I'm sure that Minister Mkhize and Minister Mboweni, and also we have CC'd the acting minister and the presidency, will be giving us a response. But parallel to that, we will be scheduling a meeting to make sure that they come before us to explain nonetheless. So even if there is no response, but we will certainly have an interaction with the relevant ministers and departments. Also, you will recall that there is the IMC chaired by Deputy President Mabuza, which is actually responsible for the whole vaccination program, particularly distribution and storage, amongst others. And so once the presiding officers of Parliament have made a determination as to where that IMC will be reporting, we will also be interacting with them. So our options are quite open, and we've got an opportunity to interact with them at quite a number of avenues.
Thank you very much. Mkhuleko Hlengwa, the chairperson of Scopa.